his child was involved in a border accident, he will miss weeks of school, as will his neighbor.
She got 3 injuries with 1 on the head and also broke her left leg.
This ward at Mulago Hospital is designed to hold 6 patients. We found more than 15, many involved in border accidents.
Whenever I'm in Kampala, I enjoy having a ride on a border, but it scares me to my bone marrow because I don't know what and when I'll have an accident. Because at each instant, the man is zigzagging across cars, stopping in the middle of the road, making unnecessary U-turns, driving along one-lane roads. It just gives a blood rush all over your body. Bodabodas are found in East Africa. Bodas are motorcycle taxis, the most common mean of transport in Kampala especially. Passengers can book them online or just stop them at any stage. They are everywhere and pass by all other vehicles with a speed up to 80 km per hour. Sometimes they drive against the traffic direction. A boda can take up to 5 people. They do not only transport human beings, but also animals, furniture, car windows, or even coffins. Let's meet the border riders. Most of them are 18 to 30 years old. They are young people in the prime of their life. This is Lucy. She is a medical resident who did research on border riders in Kampala.
Most of these bodabodas are ridden by youths who are the adolescence period, even biologically, because of the hormones that are released, people are bound to feel mortal, like immortal. They feel like, oh, I cannot die, I'm too young to die. So they are really, really reckless, and they have this feeling that nothing can come out of their action. So they're impulsive. So we realized that there was a huge problem with the bodabodas. At that time, when the study was done, they never used to get any formal training. So there wasn't like, you go to get a riding license and driving a riding permit. So most of the people would just learn from, I found you riding a bodaboda. Teach me, I'll give you like this amount of money. Then you learn and you also start riding the bodaboda. So that because of the fact that they were not formally trained, they did not know how to obey the traffic rules or regulations. No one has trained them.
Some people become a border rider due to inconvenient circumstances.
Mama ngeyafandi muto nandikanga sina mulimo. Safuna license yenye ya moto. Kati unafuna license ya moloka nenga mulimo gusokebwako unasobola kufuna.
In cases like this, the unqualified men create a dangerous situation. However, there are several authorities who try to manage safety on the roads. Meet Luke, a policeman, and Norman, a traffic policeman.
The truck is moving and you're also moving in the opposite direction, and you want to overtake it. Now you move it to another lane. There's a speeding car coming in the opposite direction. This is how accidents have been happening.
Yeah.
This overtaking of bodabodas, thinking they can fix themselves somewhere, and then the roads are not that wide.
Our policing environment is all not easy. First and foremost, it's a very challenging environment, and I would say that it is our drivers, our riders are full of impunity with high levels of indiscipline. They are very stubborn. So there is a lot of recklessness within our drivers. So when you stand on the road, of course, we have always been encountering a lot of accidents to ourselves and even to innocent civilians. So it's a bit tricky and very, very, very complicated. Some do listen to us and others don't. With high levels of indiscipline. Some don't have enough qualifications to ride and others have. Those who have, they are complying. And more especially the challenge we have with them is failing to comply with the rules and the regulations governing Road Safety Act. Yeah, they ride on pavement, they violate traffic lights, they are evidenced in riding in a one-way and among others. So those are the challenges we normally encounter.
For example, we've tried to partner up with some BODABODA groups as police, sensitizing them of what they're supposed to be doing, to at all time know that moving on a BODABODA with no helmet is actually a crime.
It's now a must for a BODABODA rider to wear a helmet in the CBD. And those who actually, you find that sometimes you take a BODABODA, say from like Mulago, like from the outskirts, then as you're approaching the CBD, he reaches somewhere in the back and gets a bag and puts on his helmet because he knows he's coming, he's moving towards the CBD. And anytime that I take a BODABODA and I do that, I always ask them, do you know what the purpose of the helmet you're wearing? It's not, you're not wearing this helmet because you'll be arrested for committing a traffic offense. This helmet is for your safety. I mean, I think every other week someone was burying a BODABODA rider or something. It had reached a point where it was really, really horrible. Yeah, and the industry was growing so rapidly. I think in 2010 there were about 5,000 boarders by like 38,000, but the exact number is not even known. And in the central business district alone, there could be even more than 1 million BODABODas. Because I think if you stood just at one junction, I don't know how many BODABODas you see. So there is so many BODABODas. And the number is increasing every day. Yeah.
So many BODABODA riders, so many people, you can imagine that a lot of accidents happen. How big is the impact on the hospitals? This is Dr. Alexander. He has been working for years as a head of emergency department in Mulago Hospital.
In our country, we must accept that the BODABODas are an important part of the transport industry. They are definitely filling in a gap. So many people use them. Yeah, in the emergency here at Mulago National Fire Hospital, which is the biggest hospital in the country, and we receive most of the patients in the country. We get a lot of road traffic crash victims. So we have a big number of patients admitted here as a result of BODABODA accidents. But per se, in terms of the emergencies admitted here, about 70% as a result of road traffic crashes. It costs a lot, because now if somebody has a road traffic crash injury from BODABODA, fractures his limb, first, maybe if it is an open wound, he needs to go to theater. He has it cleaned up. Might need to have an implant inside. Implants cost money. antibiotics, the stay the patient is here, is not earning at that time. He might be, most likely this person who is injured is a young adult, okay, who is moving around, is the bread earner of the family, so the family will suffer because of this injury. So it's actually quite expensive.
Border riding can be very harmful and life-threatening, not only for the people on the border, but also for the pedestrians and other road users. I can imagine that you are wondering why people keep using borders. Now you have heard how dangerous they are. What is the process of bringing a victim from the road to the hospital when an accident happens?
Most likely they are transported to hospital by whoever gets them. And we have a lot of police patrol vehicles, so most likely they will be the ones to bring the patient. But they will bring the patient to hospital. Patient will not have any pre-hospital care.
The police estimates that there are 2 to 10 deathly accidents a week. What causes this huge number of casualties? The golden hour is a medical term for the first hour after an accident. The chances of better outcomes and survival are determined by the care that is given within these 60 minutes.
Because when you have an injury, it's the golden hour. Okay, I don't think we are able to
No.
to achieve that. All right, I don't think we're able to achieve that.
The fact that there is no ambulance service and no one responsible for transfer to the hospital makes that the golden hour is not achieved. In the end, we are only talking about the people who actually come to the hospital. In fact, there are even more victims. In part 1, you learned how big the border problem is. In part 2, I would like to discuss multiple initiatives to fight the problem. These are all set up to make the city safer. Meet Ken, one of the initiative takers who is trying to provide a solution.
Every Ugandan has a chance to an ambulance service. Every Ugandan has a chance to the hands of a paramedic within the golden hour. And that the border people themselves, their lives are transformed in the process. Borders today in Uganda are known for almost the worst of vices. We call them failures. They are the school dropouts. They are thieves. They are robbers. They are murderers. And they are a perfect example for a failure in Uganda, of which all these very mean words are landing on the head of a 20 to 30-year-old child. So it has created the killing machine that we are complaining about today. That is involved in so much of the accidents that are happening on the roads. We are trying to go back and change it.
There are several initiatives with the border problem. One of them is the Safe Border Company, whose riders can be recognized by his orange helmet and a flare jacket. You will see them with a maximum of 1 passenger and they obey to the traffic rules.
I think it is more of an economic initiative. Someone will come out with an idea and are also trying to solve problems that actually Ugandans are facing the most.
So you can distinguish between safe borders and the ordinary borders. Research has been done comparing these two groups.
Safe Border came in as a company that was going to revolutionize the boda industry and make it safer and to address that problem of transportation. So as part of my fieldwork, I decided to evaluate the impact of the safe border. So it was more of an observational study, but with comparative components, where I compared the safe borders to the non-safe borders, the conventional borders that had been around, to see how they compared in different aspects, including helmet use for the boda rider, helmet use for the passenger, the level at which they obey traffic rules, among others. So that was really the research that we did.
Safe Border trains its riders in first aid lessons. There is a group of medical students who give these lessons. One of them is Simon.
Yes, I've been doing it for months now. It's exciting. Most of the people I train have never been to school, or maybe if they were at school, they never reached so high. So it's kind of a big challenge trying to translate my information from from English, and then I have to reduce it to maybe try and interpret it in Uganda to make them understand. We managed to see some very positive results. We get pictures of some of our trainers and some of the people we trained with the results. Pictures like they were passing by a place and then found a road accident and tried to use easy to get tools, that maybe like sticks, to immobilize a fracture, such things, and they're very, very nice and encouraging. Makes you want to do more. So
let's see if the authorities notice any difference since Safe Border has been introduced on the road.
There is a very big difference. Safe borders are a bit trying to follow the rules and respect the rules and regulations governing the safety act. They are trained, they respect us, they do comply with our orders.
Effort has been made already. Still, a lot of accidents happen. What can be possible solutions for in the future?
But if we did have all this traffic jam, probably solutions like the railway, or we call it a subway, site of viewers, subway stations, maybe even big bus companies that would actually offer enough transportation for all the citizens in the city. I think it would actually reduce on the need of boda.
This could soften the problem in the future. But for now, transport is essential in Kampala. Therefore, we are still struggling with the fact that, on one hand, borders are very dangerous. On the other hand, they are very indispensable nowadays. While Safe Border is set up to prevent accidents, I found another initiative who focuses on managing the consequences of an accident. Ken, who we have met before, gave up his medical career to work on a new initiative, Boda Musawo.
I'm trying to design a system whereby emergency help is as far as the Shell gas station from people. With Boda Musawo, we are trying to make sure we give all road traffic accident victims a second chance to life, or buy them more time to say goodbye. So this is how it will be working. We'll train the borders first. We'll train them in things to do with scene safety, triaging, and the ABCs. How to combat bleeding, how to unblock blocked airways, and how to mobilize fractures at the scene. So we'll give them a minimum kit based on their nature. We won't give them a lot of things. So we'll give them a minimum kit entailing mainly gloves and gauze. but we will have a big emergency kit at each Shell gas station where we'll have a call center. So when a call comes in, either from that community or the border person, our trained person who is manning the station at the gas station will dispatch a three-wheeler, customized three-wheeler that will be like a first aid kit to go to the scene. It will be driven by a person who is still a paramedic who has been trained, and at the same time we'll call an ambulance to report to the scene.
To conclude, Kampala is confronted every day with both logistic and social problems concerning the border borders. Perhaps Ken's initiative can change the stigma with border riders and give them a new identity.
We want to turn the killing machine to the first line of emergency service providers in the country. We want to turn them into extra hands to the health system. We want them to be accredited by the African Federation of Emergency Medicine and go into the books of the Ministry of Health as the first line of health service providers in the